Now we're talking about another type of fracture in the upper limb, and this fracture is a fracture of the wrist. So they call this the Colles fracture. Sorry, okay. They call this the Colles fracture. Okay, Colles fracture. So it mostly comes in when you are trying to fall down, then use your hand to support that fall. Okay, so to say they call it the FOOSH. You are falling, is it a fall on outstretched hand? Okay, that's the abbreviation. Okay, so that's what we got here is actually common wrist injury, and most of the times it comes in when you are trying to fall and you support yourself. So there's a break in the distal radius bone, producing a dinner fork deformity. Can you see the way your hand is like a fork? It's kind of like bent, like a fork, like the way a fork. I have a special lecture on trying to show the features of a dinner fork deformity. Okay, so it usually results when you fall on your hand and it requires urgent medical attention. So it's a fracture of the distal radius, typically 1 to 2 centimeters proximal, or say close to the wrist. Okay, there's dorsal angulation of the distal fragment. So it's named after a great orthopedics doctor. His name is what Abraham Colles, and he was the one who first described it in 1840. Okay. So just like we said, we have a dinner fork deformity. It's a classic dinner fork deformity. Your hand is kind of like arcing at this place. So common risk factors, what could make it very much more easier for you to have this fracture? If you fell on an outstretched hand, if you have car accidents, sports injuries, skiing, cycling, horseback riding, okay, then also your age, advancing age, of course, you have weaker bones. Gender is more common in women than men. Then also osteoporosis, where you have weak bones, making the fractures more likely to occur. Then environmental factors, if you live where there's slippery floors, poor lightings, and all of that, make it much easier for you to have these injuries. So symptoms include a lot of pain around the wrist, swelling and bruising around the wrist, visible deformity, that's a dinner fork appearance, limited mobility and inability to rotate the wrist. You're not able to use that hand like you used to. So nerves could be involved where you have numbness and tingling. So you diagnose it by hearing what the patient will tell you, and everything the patient will tell you will always be directing towards the activities that happen and how they are feeling. They can also use x-rays to confirm it. You can use CT scans to also confirm, and also MRI. Treatment is if there's non-displacement fractures, you do close reduction and cast immobilization. That's you try to keep that place in one place, let it not be moving. Then displace or unstable fractures, you do surgical fixation with pins and plates and screws and external fixators. You can keep the place cool with ice, and most of the times if the hand is pointing down, there's extra pain. So you try to elevate the hand, okay, as much as possible. You also use painkillers like ibuprofen and acetaminophen, okay. And I think that's what we have for Colles fracture. Let's move to the next fracture.